So today's guest has been called the father of ozone. He has been in practice for over 40 years. He is a pioneer in the regenerative and anti-aging field from way back in the early days. He brought ozone back to the USA from Germany in the late 1980s and has been training laymen and physicians on using ozone for a number of different conditions, including viral infections. He has a patent on functional testing for cellular energy, which is basically your mitochondrial function. He has authored several books, including Ozone Miracle, as well as Bursting with Energy. I was first introduced to his work in 1998, when I began using ozone in my clinic, along with one of the first regenerative orthopedic treatments called Prolozone and prolotherapy. And I first met Dr. Shallenberger in 2002 in Fort Lauderdale at a regenerative medicine conference on stem cells and ozone, where we were using it for regenerative orthopedics, which we call Prolozone. His work has helped me personally recover from chronic Lyme disease, chronic viral infections, as well as severe mold illness. Many of these strategies, such as 10 paths and major autohemotherapy, we use in our practice where we treat conditions such as autoimmune disease, chronic infection, degenerative neurologic diseases, and general health. I recently spent a week with Dr. Shallenberger last year at his clinic in Reno, taking a deep dive into 10 paths, Prolozone, and high-dose melatonin therapy. I have since developed a product called Sandman using these principles after this trip. Today, we are going to be taking a deep dive into ozone and how it might be one of the most unrecognized therapies for many acute and chronic diseases. And with the current pandemic, ozone may be more important than ever to consider as a valuable modality to combat viral infections. Dr. Shallenberger, welcome, and thank you so much for joining us.
Thank you, John. Thank you for a wonderful introduction. Appreciate it, and glad to be here with you today.
Excellent. Well, why don't we get started with you just kind of sharing with us, how did you get interested in alternative medicine and in particular ozone?
Ozone's an oxidant. And in case the people that are watching the show don't know what ozone is, let me just clarify, it's not pollution. Ozone is formed from pollution, can be easily measured, so it is a way to measure the amount of pollution in the air. But ozone itself, the way we use it medically, is pure oxygen. That's all it is. But instead of having 2 oxygen atoms, ozone has 3 oxygen atoms. Other than that, it's pure oxygen. So the oxygen that we breathe in is O2, and so that means 2 oxygen atoms stuck together. Ozone is O3, 3 oxygen atoms stuck together. Mm-hmm. And that's what we're using medically. So it's just so everybody knows, it's pure oxygen. It's just because of that 3rd oxygen atom in there, it's highly reactive. Mm-hmm. And unlike regular oxygen, which is not reactive and does very little other than support ours, ozone can actually turn the tide on many conditions. Mm-hmm. And the reason I got interested in it is because, number one, it's oxygen. I mean, what can be more important to human life than oxygen? Nobody can answer that question other than nothing. Oxygen is the single most important thing we ever take in. Yeah. And so if this is pure oxygen, I'm automatically attracted to it. And secondly, it's an oxidant. And when I first learned about it in the early 80s, the word was that oxidants were bad and reductants were good. Mm-hmm. And we now know that that's totally false, that they're both needed. They play a game together and they move electrons around, and that's what keeps us alive. So when I first heard of ozone's an oxidant, and yet it's used to heal people, I was automatically attracted. Something weird's going on here. So it's a good chance for us to learn about it. So in the early 80s, I took a trip to Germany, learned about how ozone was used, brought it back to the US, and the rest is sort of, 30, 40 some odd years of experience doing this stuff, and just a lot of clinical.
Did you have a condition that you used it for on yourself, or did you have a loved one or a special patient that you introduced it to at first?
Ozone has such a wide applicability. It's one of the things that's so wonderful about it. Mm-hmm. And so, yeah, for myself, I'd get a blood treatment once a week, mm-hmm. and I have for the last 2 years. Not because there's actually anything wrong with me, but because I want to stay at the top of my game. I'm getting to be an old guy now, and I still want to have the immune system of a young guy.
Yeah.
And I want to feel as good as a young guy does, and so that helps me do that. And the other aspect is then, I've trashed a few of my body parts, namely my right shoulder. So I've wrecked a few bikes and just kind of wrecked my right shoulder. And so I've had a bunch of shoulder injections.
Mm-hmm.
When I started doing it to patients and started scratching my head, I said, man, this stuff, it can't work this well. Something's got to be wrong. There's no way this stuff can work this well.
So when you were first introduced to Ozone back in the 80s, was it both IV and also injecting into joints and around injured tissues?
Yeah, it was mostly both what you just said. Yeah, either injections into individual tissues or the intravenous use of ozone.
Yeah. What has been some of the most profound changes that you've changed as far as the way you're using it in the clinic from when you started in the 80s to now?
That's a good question. I think that to a large extent is ever since this has been evolving with me, I've been using it more and more. So initially I was like most doctors when they learn something new. I just started very carefully picking my cases. And now I realize, just about everybody I see, of course, I'm getting very difficult cases now, but just about everybody I see requires it. So I'm using it more and more often. I mean, there are other applications that we use now, for example, intestinal applications, bladder applications, certainly applications in joints and soft tissues, applications also through the skin in terms of a sauna application. And there's other ways that we can do it now that I didn't know back then.
I'm now using a toothpaste with ozone in it that I recently started using, and I love it. I mean, the health of my gums has never been better.
Yeah, that's, for anybody out there, if you've got a periodontal disease, if you've got dental or especially gum conditions, you'll clean it right up by doing something that you just talked about, or even just putting the gross tasting oil over on the gums.
Yeah, for sure. Well, transitioning into the mouth is a bit of a good segue into viruses, because that's where a lot of chronic viral infections kind of hibernate. So, maybe you could speak a little bit to how important oral hygiene is for, anyone that's looking to have a stronger immune system or be able to combat a viral infection.
Yeah, it's an interesting point. I think that many doctors and many patients perhaps don't appreciate the connection between dental and oral health and just overall general health. But obviously, it's not like the mouth is this separate unit that doesn't attach to anything else. It's got nothing to do with anything else. Obviously, it does. If you have infected gums, if you have infected teeth, if you have even an inflammation going on in the gums, even something like that, it will affect the entire body, obviously. So we're trained as medical doctors to look in the darn mouth of people. And if it's all grossed out, we need to get that cleaned up. Otherwise, that patient's probably not going to get well.
Yeah. I think in today's world, there's so many stressors that we're seeing in our clinic as well. It's like, it's getting harder and harder to get people better. And you're having to actually go and take those extra steps with people, looking at their sinuses and looking at their oral, looking at their skin, their sleep patterns. I mean, a lot of things that probably back in the 80s, you really didn't have to do all those things to get people better. Would you agree with that?
It's getting harder and harder, I'll tell you that much. Back in the 70s and 80s, it wasn't that big a deal.
Yeah.
Nowadays, we have this, people are way unhealthier than they used to be, way unhealthier.
How do you see ozone in the future with medicine? And do you see it getting into the hospitals anytime soon?
You never know. I have to say that when you start talking about a therapy that on the one hand is cheap and not patentable and doesn't benefit anybody except the patient, when you see a therapy that meets those criteria, it's probably not going to be accepted. What you want is a therapy that's expensive, patentable, and is going to benefit big pharma. That's probably the one that's going to get accepted. That said, I don't look at ozone as necessarily being in competition with big pharma. I see the two as maybe something that can come together. And a case and example would be, you've got a guy like I had last summer who told me they amputate his arm because it had a chronic infection in his bones. And he'd been on antibiotics for a year. And all we did was continue the antibiotics, treat him with ozone, and ultimately we saved his arm and he was fine. So I don't look at ozone as like something that you use as an alternative to conventional medicine, but it's something that you add to conventional medicine. So that said, it might be that the powers that be will let it kind of squeeze in the back door, and maybe we'll actually see them doing it. I don't know. I've been expecting people to grasp onto this for 30 years. I've been teaching doctors how to do this, and I'm expecting any minute that everybody would say, oh yeah, this is wonderful, let's go. So far that has not happened, so I'm a little cynical, but we'll see.
Well, the thing that concerns me is, I, as a practitioner, seeing the miracles that we see in our clinic, from everything from injecting it into joints to intravenous and 10-pass, what have you. And we'll get into some of the science and a little bit more of the nitty-gritty on some of the applications a little bit later. But I felt it personally. And if I got a serious ailment and I was in the hospital and I wouldn't have this available to me, that scares me. What are some of the FDA approved treatments for viral infections, and what are their shortcomings? And do you see anything on the horizon that would be effective for viral infections in comparison to ozone therapy?
Okay, so first of all, the FDA doesn't have anything for viral infections. So we can start with that. It's everything supportive. Mm-hmm. So we support the patient. We put them on a ventilator. We give them oxygen. We give them IV fluids. We give them blood. We, give them whatever you want to give them. But there's no actual treatment for the viral illness itself. It's support the human being so it doesn't kill him, and then eventually his immune system will come and take over. Mm-hmm. So the FDA really doesn't have anything other than a supportive thing, and that's why it would be so nice to tag in. Certainly ozone is in there, but also vitamin C. There's actually some publications on vitamin C, and even with this new, there are like the international, or not the international, the Italian Ozone Medical Association has just gotten approval from the Italian government to start a trial on ozone therapy in particular, for example. And we already have a couple of recent online publications from doctors and hospitals using intravenous vitamin C. And the reality is that those two, when combined, really work quite effectively. Mm-hmm, mm-hmm. The only other ones, I'm not too sure of. I could think of preventive strategies, where you could spray colloidal silver in your throat, for example. You could swish around ozonated water in your throat. You could kind of do what you're doing with the toothpaste. You get a little ozone in there. Mm-hmm. I'm sure there's probably other modalities, essential oils or things like that. Zinc will kill most viruses. I don't know about this, but most viruses, if you get the zinc on the virus, it'll kill the virus. And since you can get zinc as a lozenge, and which you sort of suck on, and it's constantly in your throat, it might not be an altogether bad idea if you're sick or you're a person that is maybe extra vulnerable to a flu, to any time you're out and about, to be sucking on one of those little lozenges. That makes all the sense in the world.
It's unbelievable. So is there really something that could not only be a powerful antiviral, antibacterial, antifungal, but also improve the general health of the host? Is it possible that there's actually one modality and one treatment that could do both those things?
Well, in actuality, you accomplish both those things in the same way. And that is, the listener could ask the question that I wish everybody else would ask. And that is, when different people are infected with a given, like you could use but any will suffice. Mm-hmm. Why do some get so ill they literally die, and others don't even know they have the infection? They don't have hardly symptom one. Why is that? It's clearly not the virus. It can't be the virus. The virus should kill them both or not kill them both in the same, but no. So it's the way they react to the. And so the only way, literally the only way that anybody can get over any viral infection is through the immune system. Mm-hmm. Ultimately, the immune system has to come in and take over. And so conventional medicine says, look, what we're going to do is we're just going to give them some oxygen, give them some fluid, keep them alive, and hopefully their immune system will take over. What we do is we're going to give them what they need to keep them alive, and we are now going to give them something that'll start their immune system 400 to 600%. And that's called ozone therapy. Mm-hmm. So if you do both those things, and vitamin C, by the way, but if you do both those things at the same time, now you're going to, in all likelihood, get almost any person through it.
But like you said, you know, it's such a exquisite way of treating a patient, but yet it's free, you know, basically free. It's ozone, right? So it's not patentable. And so there's no motivation for anybody to run ads on TV and put ads in the newspapers. And unfortunately, that's the world that we live in today.
Yeah. And that's the problem. So one thing listeners could do is they could go to Amazon, get a copy of my book called The Ozone Miracle. Mm-hmm. And in there, you know, it talks about how you can buy your own ozone generator for something in the order of $1,900 and have it at home and give yourself treatments at home, which to me is the way to go now, because I'm not like waiting and holding my breath for there to be an ozone practitioner on every block in this country. And There are going to be a lot of people out there that, you know, they're going to call around or Google around, and they're not going to be able to find a doctor in their area that gives them ozone treatments. Mm-hmm. And so their only recourse is go out and do it yourself, which is probably the better thing anyway. In the long run, it's the best way to go probably. So it makes all the sense in the world for really all of us, me included, whether there's something wrong with you or not, get an ozone treatment at least once or twice a week, just as a preventive mode. So you're in that mode so that if you do ultimately get challenged, you know, if there's an infection or if you fall off your bike and you break your leg and you end up in the hospital, whatever is going to go on, if you got some kind of challenge, your body is up to it and it'll do well.